Welcome to America's Heroes Group.
And welcome back to America's Heroes Group. This time as Roundtable, we are globally connected with Kaiser Health News. October is National Breast Cancer and Domestic Violence Awareness Month, and today is Saturday, October 30th, 2021. Our host is Cliff Kelley. I'm the co-host, Sean Claiborne, U.S. Army National Guard veteran. Our executive producer is Glenda Smith, and our digital media producer is Ivan Ortega of Scouts Honor Productions. And please join America's Heroes Group now on global live streaming on Facebook. Our radio talk show is live on Facebook now. If you haven't clicked in or liked us on Facebook, go ahead and do that. Like and share so others will become connected to the information and resources that we provide. You can also listen to America's Heroes Group on the iHeartRadio app. Just search America's Heroes Group and watch us on digital TV streaming on even Roku, Amazon Fire TV, Apple TV, through our partner Zondra's TV networks. That's Zondra, Z-O-N-D-R-A. You can search that on Roku, and it'll pull us right up, and you can start watching some of our past shows. And our past shows are on YouTube as well. So today we have another interesting topic. It's going to take us to a lot of things. It's a long time coming for this type of legislation to pass. We have a panelist who you've heard her voice before in our show, Jenny Gold. She's a senior correspondent at Kaiser Health News. How you doing, Jenny?
Hi, thanks so much for having me.
We also have Gigi Crowder, the executive director of NAMI, Contra, Costa, California. That's the nation's largest mental health organization. That's the National Alliance of Mental Illness and Advocacy group funded by family members and people with mental illness. Gigi, how are you doing today?
I'm great. Thanks for having me.
All right. And then last but not least, Ernie Stevens, who is the subject of an HBO documentary with his partner, and that is the HBO documentary Ernie and Joe Crisis Cops. Okay, Ernie's been a San Antonio police officer for 28 years, and we're going to talk about that and also how we can de-escalate certain situations and certain issues when it comes to mental health and also the problems that come with mental health. So first, Jenny, take us through the landmark legislation that came about last year about now the new number. We all know about 911. But what is 988?
So 988 is a lot like 911. It's going to work in a similar way. You can dial the number 988 from any phone in the country, and it will connect you directly with a national suicide hotline. Right now, you have to call a 10-digit number that if you're in a crisis, that can be hard to find or remember. This makes it really easy. You just call 988 from any phone line, and you'll be able to talk to a trained professional who can speak to you about your mental health crisis. But in an ideal world, it doesn't end there. It's not just about who picks up the phone. It's also about what happens next. Right now, if you're in a mental health crisis and you call 911, often a police officer is sent out to assist you and de-escalate a situation. And we know that that doesn't always end well. About 1 in 4 people who are killed by police officers are people with severe mental illness. So we know this can be an issue. So the ideal of 988 is that instead of a police officer, when possible, trained mental health professionals will be sent out instead to help stabilize you and help you make it through the mental health crisis, and then connect you to follow-up services, connect you to a crisis center or other ways you can get care rather than going to jail.
And I think that's a groundbreaking news. That's groundbreaking legislation because oftentimes, as you mentioned, when people call 911, we've had a string of police shootings. But there's a statistic that came out from the treatment of advocacy center.org. People with mental illness are 16 times more likely to be killed. You mentioned just now that 1 in 4 police shootings involved some type of behavioral issue or mental health crisis, things of that nature. Gigi, tell us about your organization and also let us know some background information about how this legislation came about and what it does mean in the future. When does it actually start when we can start dialing 988 for certain situations?
Well, our earlier speaker might have more information about what's happening nationally, but here in California, after a unfortunate situation with a young man named Miles Hall in Walnut Creek, California, our affiliate, NAMI has 600 affiliates across the nation, got really involved because his mom had came to us seeking support. And too often when individuals are seeking support, they can only use the option of calling law enforcement. So we worked with a local legislator, Assembly Member Rebecca Byer-Cahan, after the untimely death of Miles, And we worked with her, and she wanted to be the first. It didn't happen, but she wanted to be the first jurisdiction to make sure that there was an alternative number and that 988, and that it would have the call centers as mentioned earlier. So NAMI is largely an advocacy agency. We educate family members when they have a loved one who starts experiencing symptoms or possible signs of mental illness. And then we also offer support to families. So I kind of took this personally since Mrs. Hall had come to us and we weren't able, although she'd done everything right by contacting her local law enforcement agency and making them aware of Miles. She'd spoken to an officer who had worked with him in the past, but still, it did not work out the way we wanted. So for the last 18 months, we've been working with the assembly member in her office to try and get our governor to sign this bill, and hopefully it'll happen in the next session.
Mm-hmm. So the legislation that was passed last year, and that's the National Suicide Hotline Designation Act of 2020. That is something that's going to roll out across the United States, but every state is going to roll it out slightly differently. Is that correct? Am I getting that correct, Jenny and Gigi?
That's exactly right. Mm-hmm. Each state has to pass its own funding legislation, has to set up 988, and figure out exactly how this mobile crisis response system is going to work. So it's going to really vary by state, and possibly even more locally. It could vary a little bit by county as well. Mm.
Now, Ernie, I really want to talk to you also because you are actually a police officer in the San Antonio area. You've been a police officer for 28 years, and you're the subject of the documentary on HBO. Now, this documentary has gotten a lot of attention. Won the Grand Jury Prize at the Independent Film Festival in Boston, Best Documentary for the Townsend Film Festival, Jury Award for Best Documentary Feature. That was at the Santa Fe Independent Film Festival. So in your career and your work, tell us the challenges of being called out on a 911 call, because the title of the documentary is Ernie and Joe Crisis Cops. So we don't think of our police officers typically as crisis cops or people who are crisis solvers or mental health people. We think of them typically as just people that are there to protect and serve and help us when we're in a bad situation. Oftentimes, however, as we mentioned earlier, things don't go well. Things don't go right. Sometimes people get hurt or get killed. So give us some insight into your job every day and also what your thoughts are on what this whole thing means.
Yeah, so of course we all know, if you've watched and paid close attention to what's going on in the criminal justice world, the role of the police officer has changed. They are becoming crisis response officers to deal with mental health crises that happen out in the community. This dates back because of deinstitutionalization. Many individuals that were very, very sick were released from the state hospitals into the community, and the community did not have the infrastructure to support them. So now these crises happen out in the community. People that don't understand mental health or mental illness are confused by some of the behaviors, and they call 911. Well, when that happens, you get a police response. The problem with that is a lot of police departments across the nation have not received crisis intervention training, which is how to recognize a mental health crisis and then how to de-escalate it. And those that have received the training, a lot of the training is decentralized, so no one department does it the same way because of the resources that are available within that community. So the challenge is real. The expectations from the community is for a different type of response. That's why you're seeing legislation like 988 passed. And I believe, if I'm not mistaken, it goes into effect July of 2022.
Mm-hmm. So that's groundbreaking to me, because now you have an actual hotline that you can call when someone is having an issue or having a mental breakdown. And this affects not just veterans. We're not just talking about people that suffer from PTSD. This is something that affects pretty much every facet of every community. You have people that have mental health issues all across the United States. There's no boundary that mental health issues don't cross. It doesn't matter what your race is, your gender, your sexual orientation. It affects everybody. And we have tons of stories that go back decades and centuries, even if you want to go that far, with where things have happened where law enforcement's been called in to take care of a situation that they're not necessarily trained for. So, Jenny, can you talk a little bit more about the importance of the crisis teams and how that came about and what that is?
So, yeah, that's right. I misspoke slightly. It's that 25% of all officer-involved shootings are of people in mental health crisis, not killings. But still, this is seriously, a real issue. And as Gigi mentioned earlier, a story of a young man in Walnut Creek whose family says he had schizoaffective disorder, I believe, and he was killed in an officer-involved shooting. So, police officers have a lot of responsibilities. They do a lot of things, and they're not trained mental health professionals. They're busy, and this is not what they're trained to do. They're not trained to de-escalate people who are in a crisis, having a psychotic break, who are severely suicidal. The idea here is that you should be sending out people who are specifically trained to deal with these situations. And it's not easy, and there will still be situations where there is some danger and hostility involved, and a police officer will still have to be dispatched. But the hope is that that will be in addition to a trained mental health professional and possibly a medic. And these are people who can help, rather than shoot or create a more escalated situation, can actually help calm the situation down, hopefully remove the risk that someone would commit suicide in that moment, and connect them to follow-up care. That might mean private, weekly behavioral health visits. It might mean taking them to a hospital if it's a serious crisis. It might mean taking them to a crisis center where they can get 48 hours of care, get them back on track, and then allow them to be part of an outpatient system. It's about connecting people to other levels of care to get them help. But there's sort of a flaw here in this whole thing, which is that we know nationally we have a huge problem with our mental health system. Mm-hmm. There's just a huge shortage of beds, shortage of providers, shortage of crisis stabilization units. So along with just having this phone number and sending mental health crisis teams, the states and the country as a whole really needs to look at what else we need to add to fill in those gaps, making sure that services are available to people who have had a crisis.
And then, Gigi, that leads me to our next question, because you touched on a very powerful point, is the fact that you also have, we can talk about funding in a minute, but also access to mental health care. So possibly what I see as a potential, and the reason why I think this is a huge game changer in our country, not just in individual states, but at the countrywide level. Just imagine if Laquan McDonald had access to a 988 number, because you can actually call this numbers not just at the crisis moment, but someone from understand in many different states as this being rolled out, they can call this number as a situation is escalating. So a person might be suicidal or have certain types of ideation about maybe killing themselves or hurting someone else. Am I right or wrong if they can actually use this resource to actually get help or try to seek help when they have red flags going up? Gigi?
Actually, yeah, that's precisely why we pushed so hard for AB 988. It's because there was another unfortunate situation in Antioch, California, and the young sister of Angelo Quito said, was there another number I could have called versus 911? And that reminded me of how important the 988 number is. There was no weapons involved. There was no need for it to be law enforcement. He was holding on tightly to his mom, but had a therapist, had maybe perhaps even a family member or a peer shown up, or an EMS worker, then perhaps we would have had a better outcome. We in Contra Costa County actually responded to the community's outcry for a much more compassionate approach to medical emergency, because having a mental illness is a medical condition. And so we would prefer to have EMS. And as was mentioned earlier, we recognize that there will often be times where law enforcement need to come out, but in working with law enforcement, and Ernie can speak to this, we kind of identified only two reasons. If it's imminent danger, or there's of someone's life being lost, or if the individual has a weapon, a deadly weapon. So those are the only two reasons you would need. We have the culture of police officers responding because they have a faster response time. Mm-hmm. That's the reason. And so what we would like to see happen is a triage situation in the call center. Sometimes when family members call us at NAMI, we recognize it's not an emergency, but perhaps that family member needs to better understand mental illness. So we talk with them when it's the individual and they are indeed in a crisis situation. Sometimes we can talk to them and give them resources in the community, and they can come in and speak with someone. But the work that really needs to happen is more immediate response. so we can tell someone also that they can go to a drop-in center. So we're also looking at alternatives to psych emergency services because of them being so heavily burdened with individuals. Often when a police officer deems the individual to meet the criteria of danger to self, others, or gravely ill, they're released within 2 to 3 hours because there's no space for them. So if we had other preventative approaches versus always reacting, waiting until there's a fail first approach, members hate to sit back and wait and see the signs of increased psychosis. They'd rather get services earlier on. Individuals who live with mental illness lose large pieces of their lives sometimes just because they couldn't get their meds on time. So we're hoping, through AB 988, there's other opportunities to support individuals so more individuals living with mental illness can have a better quality of life. We may also be able to address some of the issues we're seeing around supporting those who are unsheltered because they live with mental illness. And
that's what I see that kind of path, that kind of trajectory going. Because with this being launched, it seems like the next logical step might be some awareness around mental health issues. Unless news reports about unfortunate police shootings, and maybe possibly more stories about the actual impact of mental health and mental health severities around the country. Ernie, so in your job, when you go to get a call, you have to go out to a home or to a site, and there is a situation that is a crisis. Can you walk us through that experience, and also what are some of your methods of de-escalating a situation so that it doesn't end tragically?
Yeah, so in San Antonio now, we have actually evolved into a multidisciplinary response team, which means that you're going to have an officer riding with a social worker or clinician, teamed also with a medic. So you're going to get a three-prong approach to this crisis. The officer, their lane of traffic really is just to provide safety in addition to statutory law, which will give them the ability to do the involuntary commitment if the social worker or the doctor that is going to be staffed with on the phone deem that there's an immediate danger to this individual or to somebody else. So by law, the officer is the one that has to fill out the paperwork here in Texas in order to do the transport to the facility. But once the officer knows that the scene is safe, really at that point they are removed from this scenario, and the social worker and the medic step in and start their assessment. Part of the way that we will try to de-escalate these calls or these crises out in the field, if we get to a call and somebody's still in a very manic or acute state of psychosis, one of the methods we use is active listening, and it's a class that has a foundational course with the FBI. We've adopted the same format here, and use approaches of sympathy and empathy. And if you look at the documentary, that's exactly what we're trying to do when we meet with somebody in a crisis. We're trying to make a connection and focus on the person and not the problem. And if you can do that, then you're trying to focus on connection over correction. And if you use that type of approach, you can use that de-escalation skill and then allow the social worker to come in, do the assessment, and then provide the follow-up on the back end so they don't fall through the cracks with continuity of care.
Now, can you I'm asking this again to you, Ernie. So is that a typical model in most states? I don't think I haven't heard that model before. Is that something that is common, or is that something that you guys in Texas have kind of pioneered as far as trying to tackle these type of mental health issues?
Yeah, so there's different approaches. Out in Eugene, Oregon, you've had Cahoots, which has been around since the 80s, and that's a clinician paired with a paramedic, and there's no police involvement at all with that response. Other departments, I was just in Indianapolis last week for a police social worker conference where police departments are beginning to embed social workers within their department to help follow up on these mental health calls. So you're seeing hybrid type of teams put together, but multidisciplinary is definitely, I think, a better approach than just sending an officer out to a call that he's really or she's really not equipped to handle.
Now, this is a question for all three of you guys, because starting with Jenny, then Gigi, then Ernie. The reason why is because Ernie mentioned earlier, and this is something we've seen if you've been following mental health issues, in the last 20 years or so. There has been a push across the country to deinstitutionalize these counties all across the United States and get rid of a lot of mental health clinics and which we've seen the aftermath of that. We've seen an uptick in a lot of violence and situations where people with mental health issues are caught in very bad situations and get into a situation where they're a threat to themselves and possibly might even be a threat to someone else around them. So what happened in the last 20, 30 years or so that caused a lot of these health clinics around the country to shut down, particularly in the cities?
When you say clinics, I think maybe what you're talking about are the state hospitals, which was sort of what really shut down as part of this deinstitutionalization movement. We lost a lot of inpatient hospital beds at that point, and it was sort of a well-intentioned effort. The idea was to treat people instead of in hospitals, which in some cases were mistreating patients, to treat them in the lowest possible setting. So in a clinic or in an outpatient setting, somewhere where people could really be out in the community, living in their homes, rather than being, as they called it, warehoused in hospitals. But what we've learned over the decades is that we now have a shortage of those hospital beds, that there are people who really need inpatient stays, not necessarily for life, but for some extended period. And right now, we have a huge shortage. So if you need an inpatient stay, you often have to wait a very long time to get a bed. And unfortunately, that promise that there would be outpatient care for people, well, it wasn't really upheld in a lot of places. And we have a shortage of those sorts of outpatient services for people. And the result is that a lot of people fell through the cracks. You see a lot of people who are unhoused, who have serious mental illness. And the other thing you see, which is really tragic, is that jails and prisons have actually become the largest providers of mental health care in the country. A lot of people who might otherwise have been treated in an inpatient hospital or in a better outpatient situation have ended up in jail instead.
That's an important point. You said jails have become the largest housing facilitator for housing people with mental health issues. That's crazy. No pun intended, but that's nuts. That's just bananas. So Gigi, tell me, yeah, it's a tragedy, but it's bonkers to think the fact that you're exacerbating the problem. Even though it was well intentioned that it might have been, that you exacerbated the problem, made it worse by shutting down certain facilities. We have a little bit of time left, so I'm going to kind of jump to my next question, which is based on the last question, and this is for Gigi and also Ernie too. That's going down the line. So when you start talking about the hotline and how it can actually open up awareness for mental health issues, there's also a lot of talk about how the funding through the legislation, how the funding of different crisis clinics and different organizations around the country, how they get funding, this might actually help funding and help the money from the federal level get down to the state level so we can actually do more in the mental health arena.
Exactly. We in Contra Costa County just had a Measure X, which is a health and sales tax, and it was no surprise to me that the Community Advisory Board decided they wanted to fund our call center. That's because mental illness impacts 1 in 4 now. It used to be 1 in 5. It's 1 in 4 individuals. So because it does, people understand we have to have and COVID may have helped with this, us have the conversations about it because we are criminalizing individuals for living with a mental illness, and we can see the disparities that some communities are criminalized more for it. So we're pushing toward the funding that comes from Assembly Bill 109. We're pushing for the funding that comes from local jurisdictions, prioritizing where the greatest need is. So I'm not a big champion for defunding the police, but I am for reprioritizing where funding is spent. And if you actually invest more in prevention services, you won't have such a heavy reliance on law enforcement. Let them get back to protecting and serving and responding when I have a stolen car, but now they can't. And what we learned in our county was that when they go out to a 5150, they actually only deem the person to meet the criteria about 35% of the time. So that's pretty wasteful. So a lot of cities are looking at more appropriate responses and pushing for specific funding to support their cities to have a better non-police police response to mental illness, and I think we're going in the right direction with that.
Mm-hmm. And Ernie, also your thoughts on this, because specifically because you work in a mental health unit for the police department in San Antonio, which is a major city, major metropolitan area, a lot of issues and things that you find in urban areas. Do you see this as a good thing? What are your thoughts on the whole rollout, the whole process? What would you like to see added to it, if anything? And you have about 1 minute, about 30 seconds to a minute in order to respond.
Sure, I'll wrap this up as best I can. So 988, of course, is going to help with the federal funding. Texas voted against the Medicaid expansion, and that drove a nail in the coffin when it came to trying to provide more mental health services to our community. So this is going to be a game changer. What I like about San Antonio and Bexar County is the collaboration that takes place between all the stakeholders in the community. They all chip in. They put in money. They help build these multidisciplinary teams. They meet the patient before the crisis call even comes in on 911 by pre-engaging them because they already know who they are. So we're out there. We're knocking on the doors. We're trying to find out where you need your assistance so you don't end up in the hospital time and time again, because that is just not the fix to this situation. True quality of care and treatment are what these individuals need and what we're trying to provide.
I appreciate your time, Ernie, Gigi, Jenny. Thanks for your support, and also I wish you guys well and have a safe trip wherever you're going tonight, and be safe and be healthy and be happy. This is America's Heroes Group.
Thank you.
Thank you.
Thank you.
My pleasure.